Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside.
My family and I, we've just been doing a lot of making memories and just coming together as a unit and fighting this together.
At 36, busy working mom Amy Michelle Asher was diagnosed with stage 2 breast cancer. But after a double mastectomy and hysterectomy, and at the time considered disease-free, Amy Michelle was still having trouble adjusting.
I was realizing that, my new normal was not really working for me mentally, so I went to my doctor and they connected me with Dr. Hamilton.
When somebody's diagnosed with cancer, it's scary.
Dr. Jessica Hamilton works with patients in the Onco-Psychology program through the University of Kansas Cancer Center. Patients like Amy Michelle, who are going through treatment, chemo, and injections for pain, deal with the body, but it's a mind game too.
We don't want anybody to be just treating a breast or just treating a liver or a specific disease. We really want to make sure at the Cancer Center that we're treating a whole patient. And about 40 to 50% of our cancer patients are going to experience clinically meaningful levels of distress. So we want to make sure we're supporting them not just with their cancer, but with those symptoms as well.
Symptoms like depression and anxiety, all things that came back in full force when just months after thinking she was in the clear, Amy Michelle was told her cancer was back and it was stage 4.
The therapy and the work that I've done with Dr. Hamilton has really helped me be able to focus on different things and get through that fear in a healthy way.
Right now, what Amy and I have really been focused on is her primary value of her daughter, and her number one thing is being a mom and making sure that Eliza's going to be taken care of.
And that means taking care of herself too, and living this life to the fullest.
Any of my doctors will tell you she's been chasing whales, she's been going, with her daughter to Disney World, and I learned how to whitewater kayak and trying to just be active as much as I can and live life day to day to day and not worry about the end.
In addition to coping with practical matters and physical needs, many people with cancer also must manage their emotional and spiritual well-being. That is why we integrate psychological care into our standard practice. Hi, I'm Dr. Roy Jensen, Director of the University of Kansas Cancer Center, and with me is Dr. Megan Dwyer, Director of KU Cancer Center's Onco-Psychology program. Dr. Dwyer, welcome to Bench to Bedside. How can psychological support help cancer patients?
Well, as you can imagine, Dr. Jensen, getting a diagnosis like this just throws a patient's whole life into a lot of chaos. We know that upwards of 40 or 50% of patients with cancer will experience depression, anxiety, distress over that course. And so our goal is really to step in, walk alongside them, giving them some more coping tools to manage all the stress they're experiencing, be it physical symptoms from treatment or side effects, the emotional toll, their worries about their family, about their finances. So we step in and help with all those kinds of things.
Mm-hmm. So could you tell us kind of specifically about
Sure.
the KU Cancer Center's Onco-Psychology program and how it's structured?
Yeah, so we have 5 full-time faculty on our Cancer Center staff, and we see patients kind of at any point in their journey for individual therapy, for couples or family therapy, and then one of the things that I think is unique to our program too is that we also see caregivers. We recognize that caregivers share a lot of the burden of taking care of someone going through cancer. They have their worries and concerns, so we also provide services to them. We also have trainees at the doctoral and pre-doctoral level in psychology that are working right alongside the patient and right with the oncology team. So we really have this integrated multidisciplinary care wrapping around the patient and their family to go through this.
So do other cancer centers in the region have a similar type of service?
A lot of cancer centers will have a little bit of help here or there, a lot of practical things, but we really have the most robust psychosocial support program here. We have people specifically trained not just in their subfield, but also in working with oncology patients, people like social workers, dietitians, palliative care specialists. We have chaplains, we have Brandmeier Resource Center to provide education to our patients. We have patient advocates and even patient mentors who are or patients from our cancer center who've been trained to provide some peer support to other people going through this. So we really have a huge range of services and supports so that no patient or no family has to go through this by themselves.
You know, one of the things that we're incredibly proud of is that the program that you direct recently earned national accreditation for its fellowship program.
Yeah.
So tell us, what is accreditation and why is that such an important aspect of our program?
Sure. So accreditation is granted by the American Psychological Association, so that's the association overseeing all training programs in psychology. And there are only 10 other programs in health psychology around the country that have received accreditation at the fellowship level. And there are only 2 that are focused on oncology, ours being one of them. And that just means that, you know, those folks who set the standards for psychological practice and training have overseen and seen that we meet those highest standards so that we can assure that our patients are getting the best care, our trainees are, you know, at the top level so that they can walk out from day one and treat patients and be prepared to serve in this capacity. And it also says that we really hold ourselves to those high standards, that we're not just putting something together, we're really being thoughtful, we're following the research evidence around training and around psychological practice so that our patients are getting the top standard, just as they do in our other oncology specialties.
Mm-hmm. Well, that's incredibly exciting. If you're just joining us, we're here with Dr. Megan Dwyer, talking about the importance of integrating psychology support into your cancer care. Cameron Poindexter is here in the studio to take your questions. Remember to share this link with people who may benefit from our discussion. Use the hashtag #BenchToBedside. So, how can cancer survivors benefit from psychological support?
So we know that there are a few key points in a patient's kind of journey through cancer that are particularly distressing. Obviously, most of us understand that getting a diagnosis would be hugely distressing. Starting a treatment or doing something new and having scans and all of that's going to be distressing. But also moving into survivorship can be equally challenging for patients. They're kind of off on their own now. So I often give patients the analogy about a marathon runner. You know, at the end of the marathon, the people on the sidelines, the family, the friends, the supporters are cheering, they're excited. They've just witnessed and supported someone doing this incredible feat, getting through this cancer treatment journey. But that patient's really depleted. You know, they've just gone through this very, very big physically draining and emotionally draining ordeal. And so that's often a time when we can step in and help the patient. You know, one of the things patients will tell me is, I just want to get things back to normal. Mm-hmm. And what I hear from someone saying that is, I don't feel like myself, and I'm not really sure where to start. And I think that's something that survivors often encounter in moving forward and needing a little guidance and needing a little assistance in how to shape their lives and how to move forward from their cancer experience. So that's a big part of what we do for our patients here.
Mm-hmm. So Cameron, it sounds like we have a question from our audience.
Yes, we do. We do have a question. The question is, do we provide counseling for cancer patients' children?
So we do not provide direct counseling for minor children, but we do have resources here at KU in our pediatric psychology and behavioral health department, as well as our partner Turning Point has a child life specialist, Annie Seal, who we refer a lot of our parents to, so that they can get some tools about how to talk to their children about their cancer in ways that are developmentally appropriate. So our team is really focused on the care of adult cancer patients, but we do work to provide resources for families because we know this impacts everyone.
So it sounds like we offer those services, but they're not under your direct purview.
Yeah, that's correct.
Okay. So how can a cancer patient connect with one of our psychologists?
So obviously you can go online to the Cancer Center website and find some information about us. You can call our scheduling line, which is 913-588-0130. Or if you're a patient here, definitely talking to your oncologist and the team to see about those services and what they might recommend to you. We do have psychologists serving at most of our cancer locations. My colleague, Dr. Alt, serves in our community sites at the North location, Lee Summit, and Overland Park, and then our other team members are primarily at the Westwood location. So depending on where you are, you can talk to your oncology team and they can help you get set up with someone close to home or close to where you receive your care.
Mm-hmm. And just to be clear,
sure,
you don't have to be a patient at the KU Cancer Center to access your services. Is that correct?
So we typically see patients who've had their care here, but we can see patients who've experienced cancer in their lives elsewhere.
Okay. So Cameron Poindexter is here in the studio taking questions, and if you have any additional questions, please use our website to send those in. I want to thank you, Dr. Dwyer, for today's presentation. And you were telling me before we went on the air that you're from Maryville, right?
Yes.
And then went to and trained in St. Louis?
Yep, so I did my PhD work at St. Louis University, and then I did my residency at Washington University School of Medicine before coming here to KU, and I've been serving at KU for just about 8 years.
Yep. So to learn more about this program, please visit kucancercenter.org/psychology. Join us next week at 10 a.m. for Bench to Bedside. Thanks for watching.